Hello, welcome to Module 5 of Nursing Informatics for the Advanced Practice Nurse. My name is Joy Jessup. Today I would like to talk about Health Information Exchanges, or HIEs. To get started, it is essential to understand what an HIE is. HIEs are systems of electronic information exchange that allow for patient health information sharing among healthcare providers involved in a patient's care. This information is shared securely and monitored for appropriateness of access. Patient health information that is stored electronically can be transferred upon request into an electronic health record within minutes, enabling near-instant access to a complete medical file. Why are HIEs important? Well, not only does electronic health information exchange save time in getting medical information, but it allows for other significant benefits. With a complete medical record on hand, providers are better able to make more accurate point-of-care decisions that can reduce medication errors, improve diagnoses, decrease unnecessary or duplicate testing, and help avoid hospital readmissions. All of these benefits have two common denominators: increasing quality patient care and the potential for billions of dollars in healthcare savings every year. Dealing with medical information sharing is a touchy subject in today's climate. Worries about privacy and security are just a couple of reasons that individuals cite when approached about joining an HIE. For this reason, it's necessary to understand the legislation that governs HIE development and use. There are two separate acts involved in HIE oversight: HIPAA and HITECH. HIPAA is well known to most individuals in the medical field and across many other professions. HIPAA stands for the Health Insurance Portability and Accountability Act and was developed in 1996 with revisions to add the Privacy Rule in 2003 and the Security Rule in 2005. HIPAA is responsible for enforcing standards of health information, guaranteeing security and privacy, monitoring and regulation of access, and setting regulations for reporting violation complaints. HIPAA also helps to identify areas where release does or does not require patient consent. The Office of Civil Rights enforces HIPAA, and violations can be prosecuted by federal and/or state attorney generals. HITECH, or Health Information Technology for Economic and Clinical Health Act, was developed in 2009 to promote the use of electronic health records for each patient in the country. HITECH established the Office of the National Coordinator for Health Information Technology, or ONC. ONC was created in order to improve healthcare quality, enhance coordination, and better secure patient health information. ONC is composed of two separate committees: the Health Information Technology Policy Committee and the Health Information Technology Standards Committee. The Policy Committee is responsible for the recommendations regarding how to implement the HITECH requirements. The Standards Committee recommends standards determining how health information is to be electronically exchanged. Together, HIPAA and HITECH work to expand the privacy and security requirements from healthcare entities to business partners to further ensure the appropriate and safe use of health information. North Carolina has an HIE called NC Health Connects through the North Carolina Department of Information Technology. The state HIE is overseen and managed by the North Carolina HIE Authority, which mandates that providers of Medicaid services with electronic health records be connected by specific deadlines. Providers in hospitals, including physicians, physician assistants, and nurse practitioners, were given the deadline of June 1, 2018. All other providers of Medicaid and state-funded services, as well as local management entities or managed care organizations, must be connected to the HIE by June 1, 2020. Dentists, ambulatory surgical centers, psychiatrists, pharmacies, the State Laboratory of Public Health, and North Carolina Department of Health and Human Services state healthcare facilities were given the deadline of June 1st, 2021 to be connected to the state HIE. Now that we've discussed what an HIE is, how they're beneficial, and how they're regulated to maintain privacy and security, it's vital to address barriers and facilitators to use. Barriers have been identified as poor patient involvement, concerns over data ownership, financial sustainability, poor infrastructure, lack of training, insecurity, corruption, and difficulty developing standards and interoperability across the board. Including in this list of barriers is the lack of importance providers give to data and decision making. Facilitators for use include ensuring stakeholders' understanding of HIEs as relevant and advantageous. Leapfrog technologies can also be excellent resources used to help integrate HIEs into current practice. Provider and stakeholder buy-in and use of HIEs are crucial to ensure quality, comprehensive patient care and to help reduce the yearly healthcare expenditures by billions of dollars. One suggestion to increase the use of HIEs involves increasing provider access to training for those that are new practitioners and those that are seeking remediation because of poor understanding of HIE use. Making additional training classes available, especially at convenient times, can help to increase the number of providers that reliably use HIEs. Designating HIE mentors for those that are new to HIEs or those that are having difficulty with use can help those not willing or able to attend full training classes. Alternately, forming a task force for the communication with stakeholders about HIE use and the benefits it provides may help to increase stakeholder buy-in. That will also increase participation in HIEs. Focusing on the benefits to both the individual and the economy can help to balance out the expenditures needed for initial setup and maintenance of the electronic health record and HIE. The previous suggestions are just a few ideas that may help nudge our current healthcare climate to embrace the use of HIEs and reap the benefits of healthcare savings, quality patient care, timely care provision, and more accurate diagnosis and decision making.